Out in the public today, answering questions about eyeballs. Don't stump me.
So I've been having this issue. Usually when I'm like sleep deprived or if I have caffeine, my eyes get like really red, like bloodshot to the point where they like hurt really bad. So is there like an explanation as?
Yeah, you're getting dehydrated, you're drying your eye out. At the end of the day, when you go to sleep, all the dry cells will recover. So if you're sleep deprived, your eyes are just exposed more evaporation, you're getting dryness. I would just stay hydrated and maybe add an artificial tear here and there.
Okay, perfect.
I appreciate it. Thank you.
I don't have any questions about eyes.
Anything about eye surgery, LASIK surgery?
I know it's scary. I don't like, having my eyes tampered with, really. I mean, LASIK is actually okay, because that's like a laser, so it's a little bit different.
Every surgery has risk, no matter what you do to the eye,
For sure.
right? So there's always a risk for infection and whatnot. So with LASIK, you create a flap. Lasers applied reshapes the eye. That flap goes back down. Then you use an antibiotic, anti-inflammatory for about better part of a week, and then you have to lubricate the eye.
Do carrots actually help?
You could eat 1,000,000 carrots. It's probably going to turn your skin orange, but it's not going to take away your eyeglass prescription. But carrots do have some health benefits for the back of the eye, just good retinal health, but it's not going to eliminate your eyeglass prescription.
Okay.
I knew another guy that I worked with who had like his eye actually like cut open or something like that.
So there's a couple different things. Like right now, one of the newer technologies, ICL, essentially it's a contact lens that gets inserted inside the eye. It actually goes behind the iris. You do cut, you go into the eye, but it does work well, especially for higher prescriptions where LASIK's not an option.
I assume LASIK would probably be like more expensive or something, right?
Believe it or not, nationwide, the ICL surgery is more expensive.
Really?
At our office, all the pricing is the exact same. So whether it be LASIK, PRK, or ICL, we want the patient to make the decision that's going to be best for them, not based off finances.
I see. Okay. Like that same person I was telling you about, he actually had some kind of glasses where it's like a dual lens. So it's like part of the lens is for nearsighted, and I think the other top of the lens.
Yeah, it's going to be some sort of multifocal. You get over the age of 40, we all lose our ability to focus our eyes. So
Is that like a guaranteed
it's
thing?
a guarantee, yeah. Unfortunately, we haven't figured out a way around that one.
All right, nice to meet you.
You too, buddy.
So I want to know if it is normal to have pupils be two different sizes.
Well, has it been like that like your whole entire life for the most part?
It happens when I get tired mostly. Just one gets a little bit bigger than the other.
It is possible to happen, but typically what we'll do, we dim the lights down, look at your pupil size in like complete darkness. If there's a difference, one pupil is like 7 millimeters in dark lighting and the other one's 4 or whatever. So it's a big difference that needs to be looked into a little bit further. So
Thank you so much.
thanks for stopping in.
Could you entertain me and like kind of wear my glasses for a second? See if you could tell me roughly what my script.
You are nearsighted for certain. Well, I can do this. Take off your glasses.
Yep.
Look at your wristwatch. Tell me when it goes out of focus.
It's out of focus right around here-ish.
Right around there?
Yeah.
So you could just tell by how close you're looking at it.
Yeah.
And you do have astigmatism a lot more in this right eye than the left eye.
Yeah.
So you're nearsighted with astigmatism for certain. I'm going to guess right around 4 doctors of nearsightedness.
Well, thank you.
No problem.
So how can I keep my eyes safe if I'm looking at a computer all day at work?
So a couple different things. You have heard the blue light blockers and things like that. They are helpful for the blue light that comes off the computer. The other thing, when you look at the computer, you don't blink as often. Plain and simple, your eyes get dry. And your tears evaporate off the eyes. So a couple different things. Maybe put a lubricating drop in periodically, and then you're constantly focusing up close. Every once in a while, break your focus, look across the room, even close your eyes. It's a muscle that's contracting to make that lens focus for up close. Allow that muscle to relax every once in a while. Look across the room and you'll feel more comfortable and actually be able to go longer.
Sure.
Okay.
Yeah, thank you.
Appreciate it, guy.
Appreciate it. How is the LASIK process done?
So you can come in for a consultation, the actual LASIK examination we map out your whole entire cornea, make sure there's no disease to your cornea. Depending on what your prescription is, you have to have enough corneal thickness because the laser is actually going to laser into the cornea. We're removing tissue there. So if your cornea is too thin, you're not going to be a good candidate for it. Depending on what your prescription is, expectations, make sure your cornea, your eye's healthy enough to have it done, you're a candidate. Surgery itself, so both eyes are done at the same time. We are sedated a little bit. Your cornea, we actually use a laser to actually create what's called a flap. Laser is then applied to your cornea, reshapes it, builds that prescription in, and that flap goes back down. Okay. You're on antibiotic, anti-inflammatory eye drops for a better part of a week after the surgery, but expect to put lubricating drops in for a couple months afterwards.
Gotcha.
But depending on your script, there's a newer treatment now too. It's called ICL. Imagine it's like a contact lens that kind of sits behind the iris. They put this prescription right inside your eye. So patients that have these incredibly high prescriptions that LASIK is just not an option, we could do an ICL.
Thank you, sir.
Yep. Thank you.